going to show you how to do the arterial stiffness test. First, we'll enter the patient into the system. You pull up the Sphygmocor software and you hit New. And you say, yes, I'd like to create a new patient. You enter their last name. This is going to be Mickey Mouse 2. Enter their first name there, their date of birth. To help you with entering the date of birth, basically, you're going to enter the day first and just type in the numbers. So if they're born on the 5th, you type in 05. Hit the tab button. If they're born in May, you type in 5 for the month of May. And then you type in the tab over to the year, which is 1955, and you're set. Select the gender, which is male, hit save, and say, yes, I'd like to accept the changes, and then you're going to search for this patient. So you just hit the search tab over here on the software. Since we just added Mickey Mouse 2, that's already, their information's already pulled up. But if they're not, all you have to do is just type in their last name, Mouse 2. You have to type in their full last name. It won't do a partial search. And then you hit enter. So I select the study tab at the top. I'm going to type in the height. We do it in centimeters and kilograms here, but you're more than welcome to change it to feet and inches and pounds if you'd like. Our patient is 185 centimeters, and he's about 78 kilograms. Okay, and then operator is just your initials. So I'll type in my initials, and we're done with the software for now. Okay, so now I'm going to prepare my patient for this test. The patient positioning is important because you want the patient to be lying completely flat on their back, rested. Their legs have to be uncrossed for their entire resting period and during the test. So you, at this point, you'll tell the patient, okay, I'm going to have you lay flat, your palms facing up or facing the ceiling, and your legs are uncrossed. Now that we have the patient entered into the database, you're going to set them up for their resting period. What you're first going to do is you're going to first tell the patient that they're going to need to relax for a few minutes. In reality, you need to relax for 10 minutes for this test. It's very important that there's a resting blood pressure that's entered into the software before you perform the test. So the first thing I do is I put the blood pressure cuff on them. You don't take the blood pressure yet, right away. Make sure the arrow of the blood pressure cuff is lined up with the center of your elbow. Get it nice and tight there. Velcro it down, and I set their arm down. Plug this in. I also find it helpful when you're putting the blood pressure cuff on to remove this from the machine because you can move the cuff around a little bit easier. Tell them, I'm going to put the blood pressure cuff on you, leave the room for a few minutes, turn the lights out. I want you to relax, breathe deeply, keep your legs uncrossed. Those are 3 very important things that the patient really needs to do in order to make sure their blood pressure is a nice resting blood pressure. It's been 10 minutes, the patient's rested. I enter the room, the lights are still off, and I come right over to the patient and I tell them to continue to relax. I'm just going to start the blood pressure cuff. So I'll do that right now. One thing I wanted to mention is that if the patient wasn't talking during the skin elasticity test and they seemed pretty relaxed, you can count that as 5 minutes of rest time. So you don't have to leave the room for 10 whole minutes. They were talking to you and chatting. You can't count it as 5 minutes. When I came back into the room, the other thing I made sure is that the patient's legs were still uncrossed. Oftentimes patients will try to cross them when they're resting. So I make sure that they're uncrossed and everything looks pretty good. And I just wait for the blood pressure to be finished. And so as soon as I see the blood pressure, I take the blood pressure cuff off the patient. I then look at my screen and I write down the blood pressure, systolic, diastolic, and that's the heart rate. So I just like to write it down right here on the testing sheet so that the doctor can see it briefly when he's just initially meeting the patient. Great. So you're going to go ahead and now you're going to enter the blood pressure you just recorded into the software. So in the fields, SP is systolic pressure and DP is diastolic pressure. So you go ahead and enter that in, 153/80. Great. And just double check that the radial button is selected. That just means that you're taking the measurement from the radial artery. Okay. Quickly ask the patient, have you had any coffee today? If yes, write it in the notes section of the software. That can have an effect on the results of their test, so it's very important to document that. The other thing you want to ask them is if they take any blood pressure medications. If so, what medication and what dose they're taking. Okay, and if they took it that morning, that's also another very important piece of information. has this sensor. It's very, very sensitive. Again, it's also very sensitive to being damaged. So you want to be careful with this. You don't want to slam it around. You want to take good care of it. Keep in mind that there's this big section, but really that middle section is what's going to be doing the measuring. So that's what the part you want to get on the pulse. All right, so we're ready to go. I'm going to hit capture data. First thing you're going to do is, again, you're going to rest your elbow right here. Okay, your right elbow is going to be rested next to the patient on the exam table. You have to be very steady for this test because any sort of small movements would be hard to capture the data properly. You're going to hold the probe at the base. I'm going to grab onto the wrist, so I'm in control of it here. I'm going to just gently bend the wrist back, not too far, but just far enough back so you can feel the pulse, okay? So I'm going to first, with my just right index finger, I'm just going to feel for his pulse. It's usually right below the thumb right here, okay? And I'm just going to set the probe right on top of the pulse there. I'm just going to hold it here very still, and the software is going to measure his pulse wave, and as soon as it measures consistent pulse waves, it's going to capture the data for us. So I just hold it here very still. Okay, so I see on the software that it's ready. I look to see how I did, and I look at the operator index, and the operator index is 100. So that means that I had a good measurement. So if it's anything below 85, you want to repeat the measurement.